It's been a challenge for us this year with the whole COVID, the pandemic going on, about how we're going to try to get our message out because, and I hope people out there aren't tired of the message, but the way we look at it is this is a prevention message. This is a message that we're trying to reach middle schoolers and high schoolers. And every year, there's a new group coming into the middle school, there's a new group going into high school. So we really feel that we just can't take a year off, even though there's a pandemic. So, this pandemic's been devastating on people with addiction. We've had a lot of relapses. Some of our homes are sober living homes. We've had some struggles, and some people in there have had struggles. Prior to the pandemic really ramping up, we were at 0 deaths in Talbot County for like the first 3.5 months. It was almost till April that we had our first death, which was unusually low. Sadly, we're more than catching up in overdose deaths in Talbot County. I'm not an expert, but I know that when the NA and the AA meetings stopped, meeting in person, they're meeting virtually, but I think for a lot of people that struggle, that meeting, I know people that go every day, that would go every day, every night to a meeting for that support. When that stopped, and people all went home, it took a while for them to ramp up the online or the virtual meetings. I think it's still different. The data still shows that our young people, I'm talking 6th, 7th, 8th, 9th, 10th, 11th, 12th graders, are still getting that stuff from homes. That's where a lot of this opioid addiction is starting. Obviously, it's going to start with alcohol, tobacco, marijuana as well, but the data still does show that a lot of the first time people try this stuff, it's coming out of people's homes. So we encourage people to keep those locked up. If you're not using it, bring them to us, and we'll get those destroyed. There's no doubt that the majority of our methamphetamine, our heroin, our cocaine are coming across the southwest border in some form, whether they're coming through a checkpoint or whether they're going around a checkpoint. The majority of the drugs are coming from there, and we still have fentanyl that's coming through the southwest border. It's also coming through the mail from China, directly to the United States through the mail in some situations. As far as the supply chain and how it's impacted in Talbot, we're seeing a change. We're seeing more cocaine and crack cocaine. We're seeing more crack cocaine's kind of making a comeback. But the cocaine, all our deaths are fentanyl deaths. So we're seeing more and more cocaine laced with fentanyl. Not seeing as much heroin as we were in our arrest data. But cocaine seems to be on the upswing and heroin seems to be on the downswing. But we have to remember that the fentanyl that they're lacing both of those drugs with is really what's killing people. The police departments are doing a decent job in identifying and targeting drug dealers, but that's not the answer. It's a part of the answer, and we need to be tough on enforcement. And we need to keep locking those people up that are profiting from other people's demise. But we really need to educate. I mean, that's the way to get out of this. We're going to try some different things this year. A lot of it will be virtual. On the 1st of September, we're going to kick off at Eastern Utilities. This year, we decided to go to Eastern Utilities to do the lighting. We're really excited because they've been such a strong partner for us. So we're going to light up Eastern Utilities in a virtual thing. We don't want people to come because we want to keep everybody healthy. And then what we're going to do is we've bought Chris Herron's new film, The First Day. So as you know, Chris was really the founder of Project Purple, which we spun off of, the ex-NBA basketball star. So Chris, we bought his film, and we're going to show that on television, on cable television. And then we're also, with that, we're going to encourage parents to watch it with their kids, watch it with their young people. And we're going to have some little work books that we're going to send out virtually to anybody that wants them. To ask questions, how to talk to your kids about what they just saw and what the thing is. And what Chris really talks about in The First Day is a lot of people that become addicted talk about the last day, the day that causes them to go to rehab. What Chris really focuses on this film is the first day, when it starts. Whether it's in 6th grade, 7th grade, 8th grade, 9th grade, whatever, how the addiction starts. But we really want parents and grandparents to understand how this begins, how it starts in the beginning. You know, we know that all those substances, drugs and alcohol, the earlier we use those substances, the more likely you can become addicted later in life. But one of the things about the pandemic is families have more time together. They're not running all over the place. So we're hoping that we can use this year, the families, to slow down a little bit and talk to these young people.